So there is a master hormone out there that is super important for your health, and it's not very well known, and not a lot of people talk about it. It is made from cholesterol, and one of the reasons that I am not keen on the indiscriminate reduction of cholesterol, especially with heavy-duty medications, is because it prevents your body from making that hormone. So I'm Naturopathic Dr. Elie Klein, and I'm here with Carol Petersen, who is quite the expert and has a lot of experience working with that particular hormone, and she'll introduce it to you in a moment. But first, Carol, let's let the audience know why they need to listen to you. So what's your background, and then reveal that mysterious hormone that we talk about?
Okay, thanks, Ellie, and it's a pleasure to be with you again. I am a pharmacist, and I was happily able to work at Women's Center National Pharmacy for 27 years. And all we did was compounding with hormones. And even though in pharmacy school, when we had the guest lecturer just talking about steroids, which produced one of my nightmares, the tests that he was giving us, I came to realize and love really the biochemistry of all the hormones that come from our, really, maybe we should start with the grandmaster is really cholesterol. So for 27 years, I worked with a compounding pharmacy, and now I am doing coaching on hormones, and I learn something new every day. And it's not long ago that I learned some profound information about pregnenolone. But as that first hormone that comes from cholesterol, so if you have a total cholesterol that's low, be alarmed. And as Ellie, you described, like statins will artificially lower your cholesterol, be alarmed because you can't make the next hormone either. Or if your cholesterol's gone unusually high, and I'm not talking about people who've high cholesterol their whole lifetimes. Those are the people that are going to live to be 100 and be healthy. And you shouldn't be messing with their cholesterol at all. They've got the genetic results to have abundant cholesterol. But if cholesterol's gone high, one of the reasons is that you're failing to make some of those downline hormones, and you can be failing to make that first hormone. And I've seen it. When I consult, I have a 3-month coaching program, and those who come into that program, I recommend that they do a large metabolic hormone panel and metabolic tests with it. So I want to see all the hormone systems, the pituitary, the thyroid, the adrenal glands, vitamin D, insulin, glucose, the whole works. And of course, pregnenolone is in there too. And so for a long time, we never even measured it because we didn't know what it meant. We didn't know the consequences. But to my surprise, I am seeing downline levels of pregnenolone in astonishing low levels. I'm going to say nanograms per deciliter, which would be US units. Give me a Canadian or European units if you know them. But for the US, those units can go all the way up to 200, 250, starting at maybe a low 50 or 60. That's the range for pregnenolone. I'm seeing people with pregnenolone levels coming up like 10, 15. Oh my goodness, if you can't make that first hormone, how can you make anything else? You're blocked. The big blockage to that first conversion is vitamin A. And this is tied into hypothyroidism.
So let me just stop here for a second and just recap. So the big reveal is pregnenolone. That's the hormone we talk about. It's really important because it's sort of a master hormone made from cholesterol. It's upstream from all these other important hormones. And what you're saying is that vitamin A is necessary for the conversion of cholesterol to pregnenolone. Is that it?
Yes.
Okay.
Okay, so this further reflects on your thyroid status. I consider this a reasonable thyroid marker because you need thyroid hormone to convert beta carotene into active vitamin A. So if your thyroid's not working very well, beta carotene never gets converted. So this can be an impediment to you making adequate pregnenolone. So sometimes I do ask people to supplement with vitamin A, but I also do supplement with pregnenolone. And astonishingly, for the last probably 6 months, I've been using a lot more pregnenolone based upon.
So I want to slow this down a little and unpack the huge wealth of information that you have in your mind in a way that's easy for me to follow. So it makes all these important hormones. So what might be clues that we need to pay attention to it, that we might have too little pregnenolone?
Oh, great segue, because why jump to what you do without knowing what it does? There's a huge bit with anxiety, and anxiety is rampant. One of the functions of pregnenolone in the brain is actually to create more acetylcholine, our parasympathetic dominant neurosteroid, I rest and relax. And we as a society now, we're getting to be like parasympathetic dominant, epinephrine, norepinephrine, or adrenaline, noradrenaline, same thing, without the balancing effects of acetylcholine.
So it promotes that relaxation part of the nervous system, pregnenolone?
Yes.
It does it through which, because it is converted to progesterone. It is converted to directly to progesterone. What else?
DHEA.
DHEA, right?
And
Yeah.
there's another mistake here that we see in steroidal charts on the internet, or we're all taught with them. The steroid cascade, it's called, and you can look it up on the internet and see it very directly. You'll see cholesterol first, pregnenolone second, and then pregnenolone branching to progesterone and branching to DHEA. There's another direct branch, cortisol.
Direct to cortisol.
One metabolic step away from cortisol. Here's another important pathway for handling anxiety. So there's the idea of, we call it adrenal fatigue, but people will argue that the adrenal glands do not get fatigued because, in part, the production of adrenaline is relentless. When you start having a surge of adrenaline, cortisol goes to meet it. Although cortisol is often demonized, I believe that its function in going up with adrenaline is to keep some balance with adrenaline and cortisol. And then, as your stress is unrelenting or super acute, you just wipe out the cortisol. And now you have basically the chronic fatigue kind of situation. You have no energy, no resilience to your environment. You end up food allergies, all kinds of things because of a low cortisol. Pregnenolone goes directly there. Progesterone helps, but it's 3 metabolic steps away. And so we have a thing. They're calling it the pregnenolone steal. And why would it be a steal? So if you start pregnenolone and you have low cortisol, you're in this extremely exhausted situation, the demand for pregnenolone to become cortisol will be very high. And remember, we just said we had 2 other pathways, progesterone and DHEA. So if you are using, I think this is the point that you have to be very, very careful with. So if you have that low cortisol, I think pregnenolone is the right choice to help fill that in if you're very low, but you cannot ignore the other 2, progesterone and DHEA, because now pregnenolone's totally diverted and not supporting those other 2 hormones.
How do you quantify low pregnenolone? How do you determine that? It on its own isn't a super reliable marker unless it is extremely low or extremely high. It's not that common to see that in the blood. I rely more on cortisol levels. And I rely on cortisol and DHEA and measure the ratios between the two, as I find I rely on that more than just on cortisol alone. But are there other ways to determine whether cortisol is too high or too low?
So of course you can pretty much know if there's high adrenaline, this unrelenting kind of stress. Even so far as I've talked to clients, their body literally shakes. They have so much adrenaline. And usually those individuals are having trouble with methylation. There's only 2 pathways for detoxifying adrenaline, methylation and MAO. And MAO, there's no drug for it. We like to inhibit it. It's actually can have quite detrimental effects, and it increases as we age. So we have inhibitor drugs, and then we don't really have anything in the natural world to work with either for MAO, that particular enzyme.
Mona, I mean, oxidase.
Yeah, I was just wondering if I should say the whole name. But
No, it's okay.
methylation,
So what does it do? How is methylation related to cortisol? Just remind me that.
it's related to adrenaline.
Oh, adrenaline. Okay.
So if you are able to detoxify your adrenaline efficiently with methylation, then
Yeah.
we're good. It's no problem. But there's a large segment of the population that does not methylate very well.
Jittery, anxious, jittery, that's a sign of high adrenaline.
Yeah, that
What
cortisol's
about
been
tachycardia, a rapid heart rate? Is that
yes.
typical?
Yeah, panic attacks, even feeling suicidal or homicidal, can
Well,
can get to be that severe. So
while
this is
cortisol is low?
if cortisol you've gotten cortisol so low, it's not balancing the adrenaline effect anymore. You can supplement with progesterone and help balance that adrenaline effect, but that
Right.
takes huge amounts of progesterone, which doctors aren't used to using.
That's right.
Large amounts of
That's
progesterone,
right.
so they're not
You're
they're
very
not
high. Yeah.
they're not going to go there. So pregnenolone, if I see that pattern, I use pregnenolone to help fill in the cortisol. I feel like it's a way to reestablish good cortisol and help your adrenals out and relieve fatigue and anxiety. Consequently, it
And you
doesn't
don't
mean
need small amounts of pregnenolone either, do you?
okay. So this was astonishing to me. Excuse me. One of the benefits of COVID was that there's a benefit of the COVID days that and Zoom. And so people met by Zoom, and there's many actually little groups meeting by Zoom, like little think tanks, right? And one of them
Yeah.
is run by Dr. Bill Clearfield. And this was not in a lecture, and I can't give you a study, but he says one day, he said, I give all my anxious women 400 milligrams of pregnenolone daily. So I sort of fell off my chair. I go,
That's right. A little
as you
high.
might, as you might too. But uh, as I thought about it, I says no worse than me recommending larger amounts of progesterone to get the job done, right? And there's an added benefit with using pregnenolone, and I use it in these situations. Sometimes people come to me with really disordered guts, with a lot of Candida in there. And when you use progesterone, it allows Candida to flare. Candida feeds on
When
your
you take
blood.
it orally.
Anyway,
Really?
one of the functions of progesterone during pregnancy is actually to support some of your immune system proteins, so you don't reject a fetus that is alien to you. So that effect of progesterone is used by Candida to overgrow that compartment of your immune system. So Candida can thrive with lots of
So it uses it to protect it against being rejected, so to speak. The
right.
immune system.
That's one of the functions of the very high progesterone during pregnancy. So Candida can
Can I stop you for a second? And you still need to remember that train of thought. But it's very common to see women who have estrogen dominance with significant gastrointestinal symptoms associated with microbial overgrowth,
for sure.
fungus, right?
Yeah, including
So,
fungus. So this is really touchy.
so how does that relate to how does estrogen factor in it versus progesterone? Just explain progesterone in the context of a fungus, Candida. What about estrogen? Does that relate to that?
This is kind of interesting too. I was gifted a whole bunch of papers by a woman who was the exec of a group called Candida Research. I was just public members, not medical people, trying to get together and try to work out the Candida problem. And she gave me this stack of papers, and they were all related to the effects on hormones by certain organisms. And interesting enough, some organisms produce 17 beta estradiol. So you end up with a disordered gut contributing to your estrogen overload. And then you have some organisms that the mycotoxins they produce bind estrogens. So it can be a mess. And when you're and you want to introduce progesterone to help balance what's going on in somebody's body, and they have a lot of Candida issues, you've got to be very careful. And I really prefer that they do something anti-Candida before they even start. But another thing you can do pretty safely is Pregnenolone. So
Interesting.
I'd like to give you a case example.
Please.
So I had a client, a 20-year-old autistic girl, and she was having severe PMS, period pain, and a lot of mood issues, a lot of anger in her premenstrual time. And I was afraid to give her progesterone because I did not know the status of her gut. But given that she was autistic, it's pretty true of autism in general. Big part of the problem is a problem with the gut microbiome. They've done a lot of research in this area now. So I gave her the Clearfield protocol, Pregnenolone 400 milligrams, and I've changed it up to Dr. Clearfield recommended the whole 400 milligram at bedtime. I like it split up morning and night rather than a big bolus. And I do that for all the hormones. They don't last very long in your bloodstream, and they go to your tissues and get excreted and gone. So at least 2 times a day is better than one big time. So the first cycle, she was happy, pain-free, no problem. After a time with this, mom told me that she was starting to talk. I didn't know this, but she could talk, as mom explained, but she didn't have conversations. She had no back and forth. And with the Pregnenolone on board, she started to talk for the first time in 20 years with a discussion.
Since you brought Pregnenolone to my, onto my visual and field, so to speak, radar, I kind of also started treating it like a neuroprotective substance. And I have been employing it in situations where the nerves and nervous system required extra support. And that's another testament to that.
It certainly is. Before I even recommended this to anybody, I bumped up my Pregnenolone to 400 milligrams. I did 200 twice a day, and I didn't notice much of anything till about 3 weeks into this. I was just talking and wanting to recommend a person and a company to somebody, and I always had trouble in my mind with this person's name, Alexander Rifton, and I'm talking and it just fell out of my mouth, thinking necessary. And I go, oh my goodness, I think this Pregnenolone has really helped my cognition here and being able to find those things. And in fact, if you're getting to be well known in aging, is you start forgetting words, you start going into rooms, forgetting why you went there. We make jokes about this, but it's not funny at all. This
No.
probably is a very good indicator that some Pregnenolone is probably missing. Plus, Pregnenolone concentrates in the brain. It's really involved in focus and concentration. So if that's flagging, we have some big problems. I also want to point out, even though I could measure in the serum a low Pregnenolone, that was not a measure of the brain. It was not a measure of what's going on in the nervous system tissue, because Pregnenolone is so important to the nervous tissue. Both Pregnenolone and progesterone are made in the Schwann cells, which protect the myelin sheath around each and every nerve in your body. And so we don't measure that either. Anything neurologic is bound to be helped by Pregnenolone.
Yeah, it sounds, Dr. Pete used to talk about progesterone as a youthfulness-related hormone. And it seems to me that Pregnenolone is very much that type of hormone as well. And you mentioned the connection between cholesterol and its effect, or when it's absent, its negative effect on cognition, cognitive function, mental functions as well, actually. And so that in part is attributed to not just the presence of the myelin around the nerves, but the metabolic activity of the nerve cells, the requirement for energy. Our nerve cells, the brain needs a lot of energy relative to the rest of our bodies. And so the role of cholesterol in supporting mitochondrial function is established, well known, and I would think that it, at least in part, it is related to its conversion to pregnenolone. I don't know if you have
Or you mean from pregnenolone. To get to estrogens, it's down that DHEA pathway, which is a precursor to testosterone, which will then convert aromatase into estrogens.
So what I'm getting at is, how does pregnenolone, do you know how pregnenolone specifically affects the mitochondria?
That's a good question, because I think you're good. You introduced the idea of redox, by the way. And so I was
Yeah, something I'm
checking.
very interested in. Yeah. And
I w-
just to clarify before we get into it, redox it relates to basically the idea that to produce metabolic energy from the food we eat, electrons are pulled from glucose or fatty acids. They're captured by eventually by oxygen, and ATP, energy is produced, and water is produced in the process as well. So is carbon dioxide. We have a number of different molecules in the middle that are like helper molecules, including very commonly things like NAD and NADH. And for example, one of the things that is related to poor chronic health is not having enough NAD plus, which is positively charged, meaning we have excess electrons in this particular instance, whereas the opposite can happen as well. We might have too few electrons, which may also short circuit the system. So having a certain proper balance of electrons and protons is very, very important to this energy generation system. It's like we're an electrochemical, our body is an electrochemical system, if you will. So that's what I refer to when it comes to redox, and I really like looking at health from that point of view, from those types of glasses. So please, if you find
Yeah,
anything interesting in that
the
regard.
body electric. I looked that up after you posed that, and all the steroidal hormones participate in redox. And interesting enough, I think it was testosterone, which is the biggest puller. It wants more electrons, and estrogen at the other end was less. The rest of them in between. Rather interesting. So it's not only, we're so stuck on this model of lock and key that substances have to have a receptor and fit in that receptor to produce a response. There's a whole lot of other issues around this. And this whole electrical nature, I had looked into years ago, because I thought it was a piece I'm missing. And it's sort of more subtle with steroid hormones. For the most part, we think they are electrically neutral. And the basic four-ring structure is, but then you start putting a hydrogen group, a hydroxyl group, a carboxyl group on that main
And these all
structure.
change the charge of the steroid.
These
Yeah.
these have charges, and even if you count just the hydrogen bonding, that I remember having to do a special report on hydrogen bonding in high school, and I went into in great depth and bored everybody to tears. But this is a strong attraction between two hydrogen bonds. So there is an electric force going on with all these steroidal hormones all the time. Because of that, it's not so strong as like sodium chloride would bond to each other and create salt. This is a very, very tight electrical bond. This is much, much less stronger, but really, inevitably, it's everywhere in your body, acting in these very interesting ways. So I think it's a interesting thing to bring up, because those molecules made from cholesterol are everywhere, and they're so important. I think I also looked up just the cholesterol. If you count just that one thing, how intimate piece it is of all our cell membranes. I think I read 80% of each cell membrane is usually cholesterol. And from that cholesterol, really, it's not just sitting there inactively. We have these very static ideas. Everything's in motion all the time. There's enzymes doing things back and forth, electrical charges switching things around, proteins moving. I mean, our body is superbly active. And these are big players. The hormones we're talking about are huge players in the whole thing.
Right, right. Do you remember, did you find out whether pregnenolone is more of a net donor of electrons, which would be a uh, a, a reductant versus an
Yeah,
acceptor of electrons, which would be an oxidant?
that I didn't see, so I can't
Yeah.
say.
Okay.
There's something else kind of interesting in these molecules, and I don't know the answer, and I've done some AI searches too. But the progesterone and pregnenolone, those molecules have 3 methyl groups. Testosterone has 2, estrogens have 1.
Interesting.
So what
Okay.
does that mean? And they're not methyl donors. Like I talked about the methylation detox process.
Yeah.
It's not involved with that. But interesting enough, the receptors for
So it's a testament to how structure affects function, and we know that estrogen is the most problematic one in high doses versus progesterone and testosterone. So obviously those methyl groups have an important role to play in that.
the receptors accept those methyl groups. Back to that part of the whole activity,
Interesting.
the receptors have a thing, and so it seems to me kind of mysterious and wonderful. All these molecules that are
Yeah.
so active in our body.
So let's switch gears a little bit from, probably boring everyone this chat, but maybe let's talk more about practical applications. So I'd love to hear more about what other applications you might be familiar with for progesterone and also for pregnenolone, I should say, and also whether you would recommend it for both men and women. We typically tend to recommend progesterone more to women, although could probably be potentially helpful for men as well. And I think that you might have some announcement in that regard to make shortly. But first, let's talk about pregnenolone. So what other things can it be used for successfully? Can
Um,
it be used by both men and women?
yes, it's a sexually neutral hormone, as is progesterone too. Important thing. And not that all sexes don't have all hormones. It's in various amounts. Men have predominantly testosterone, women have more estrogen at particular times of their lives, but that has a bigger influence. So that's the only distinction, is the relative amounts of each that tend to play a role. But sexually neutral, pregnenolone and progesterone both. And pregnenolone used to be a FDA approved drug. Name of the drug was called Enolone.
Oh, analone?
Enolone.
Interesting.
They came in 100 milligram capsules, and the dose range was 100 milligrams to 400 milligrams a day. Oh, no, sorry, it was 500 milligrams was the top end of the recommendations, and it was used for arthritis.
Ah,
And
isn't that interesting?
yeah, and so it's got great anti-inflammatory effects. How it lost its favor was along came prednisone. And when prednisone came on the market, it's such a strong anti-inflammatory. It was like a miracle for people. And they didn't find out for some time after they killed a few people, because they very happily gave them prednisone, which completely shut down your adrenal glands. And if you dropped your prednisone dosing abruptly, you had no adrenal effect and you could die.
What you're
That's
saying is that you can give pregnenolone for people with, is it osteoarthritis?
rheumatoid.
Rheumatoid arthritis.
It was approved for rheumatoid arthritis.
That's even harder to treat.
Yeah, and isn't that interesting? And they have studied
What
doses of
dose?
100 to 500 milligrams for arthritis. They have studied doses up to 800 milligrams to look for side effects. And once you get up over 800, you're starting to see effects, but they're coming from, like, you might get excessive androgen or excessive estrogen effects, because then it's definitely moving down that steroidal panel. And back to the 400 milligrams recommended by Dr. Clearfield. He's not saying do 400 forever. Do it for a few months, and then you probably can do a maintenance dose of 100 to 200 milligrams.
Is it clear what the mechanism of action by which pregnenolone help with rheumatoid arthritis. It must have anti-inflammatory properties that
Yeah.
I believe progesterone does too.
Both of them have strong anti-inflammatory properties. I couldn't tell you the pathway. It'd probably be boring anyway. So we know that it is actually, and that steroidal cascade, first cholesterol, then pregnenolone, then progesterone, then cortisol, all its derivative. That's a whole anti-inflammatory pathway, including cholesterol's anti-inflammatory, by the way.
Right, right. Very interesting. Do we know what effect pregnenolone has on the gastrointestinal tract and the barrier specifically, or the microbial makeup of the gut?
I don't know specifically, but I do know that if there's a Candida problem and you use pregnenolone, you simply do not get the wild activity that you get with progesterone. So as a first step, sometimes I use it as they're working on their gut. But I do like to introduce progesterone and DHEA. Like I said, I don't want pregnenolone just on one pathway and taking care of that, and the other two hormones become deficient. And you do have to keep that in mind.
You like to use the two simultaneously or one after the
Yep.
other?
Yep.
Okay.
Yeah,
Okay.
definitely.
It seems to me that also it might be based on what you said earlier, it might be a viable way to start treating someone who might have low thyroid function.
Yep. And conversely, also from Ray Pete, once he wrote, the things that interfere with your thyroid would make a list as long as your arm. And then he said there's three things that support thyroid, and it's pregnenolone, progesterone, and coconut oil.
And glucose.
And methylation.
There are a few other things for sure.
So this is actually what I like to do when somebody comes to me and they have some evidence of low thyroid, but I really like to put pregnenolone in there, put progesterone in there to support their thyroid, make sure they have iodine, 100%, and then selenium too. So we've got kind of the thyroid covered on all its needs. So somebody who is functionally low thyroid might have a perfectly functioning thyroid gland. It's all this support is lacking. So I make sure all that's covered. I ask my clients to monitor their temperatures. We're looking for a temperature increase. And if we fail to get that, then I'll go back to look at thyroid again.
As a side thing, I just want to share with you, I'm looking a little more nowadays at succinic acid and succinate. And one of the things I read was that it enhances pregnenolone production. And,
Really?
yeah, I thought I'd share just because it would be relevant to the topic of discussion. And of course, it's a mitochondrial Krebs cycle intermediary,
Yeah.
which means that it's important for enhancing production of metabolism, metabolic energy. All right. Is there anything else that you'd like to share about pregnenolone?
Yes, I would like to share the story of Dr. Mark Gordon.
Okay.
And Dr. Mark Gordon started out being kind of an anti-aging physician.
In other words, he didn't like aging. He was against aging. He didn't like it.
He was against aging miserably. So he typically did something like I propose people do, is take a full metabolic panel with all the hormone systems represented. So most of his workups like that. And then he happened to have a 35-year-old come into his practice, and he just ran that same hormone panel for him. This guy had was a vet, and he had been treated by multiple doctors at this time. No relief from all the symptoms: high stress, unable to have a job, lots of anger, all kinds of things. Anyway, so his hormone panel comes back totally deplete in some major ones like growth hormone and testosterone and other things. So Dr. Mark Gordon started doing workshops, training other doctors to do these evaluations and help with the hormone support in TBI and PTSD. And this is actually really, really important because they've found out since, like, if you have a traumatic brain injury, they've monitored what happens with your hormones. And they've also found that if you give progesterone, give vitamin D, give pregnenolone immediately, that your chances of not dying increase up to 80% not dying after a severe head trauma with those hormone supports. But then
When
they're
given right away.
right away in the hospital when you come in with a head trauma. But Dr. Gordon said this is so prevalent that people have these symptoms, and the original fault was the head trauma. And why not? Your pituitary's in there, your hypothalamus. These are glands that are giving signals to our thyroid, to our sex hormones, to our adrenal hormones, the whole works. So if this is damaged, downline, everything's going to be damaged too. So I remember him recommending about 30 milligrams of pregnenolone. And this surprised me very much because at the time I was taking 150 milligrams of pregnenolone myself, didn't really notice anything. And a guy behind me said, I can't take more than 10 milligrams of pregnenolone. So I wonder, as I say, with low doses of progesterone can sometimes backfire. I'm beginning to wonder if that applies to pregnenolone too. But so he didn't have progesterone in his protocol then when I took his workshops. I hope he's added some, but that's made a big difference in so many of his patients. And he really started a specialty practice, particularly for vets, and wrote a book about traumatic brain injury. One of the interesting things he said, people forget about that. He taught us to ask people at least 10 times about a head injury. And he said maybe about the 10th time they'll remember getting a blackout with a bicycle accident or something, or playing sports, and then they'll finally remember. But that damage to the pituitary hypothalamus has prolonged effect all the way through the rest of the person's life. So there's some, I really want to emphasize that there's some chronic issues with hormones that aren't really picked up by conventional medicine because they're not looking there.
And at 150 milligrams of pregnenolone, was that vet helped by it?
I don't know what this particular vet's protocol, but this was the start of him looking in this direction, then working with the vet community, and he made a movie with them. And one of his patients, he presented his patient a couple times, another vet who had a terrible time basically losing just about everything and almost his family, had 4 children, and this completely brought him around. And so that particular vet has become an activist in this area.
He was seeking help and was treated by pregnenolone.
Pregnenolone was one of the things, but it could have been some testosterone, progesterone, growth hormone, a whole medley of whatever that particular individual needed.
Got it. Yeah. Okay. All right. Interesting. Anything else?
Anything else? Let me see. I've covered all my notes.
We touched primarily on neuro, degenerative, cognitive, perhaps mental health issues that it can help with. And on the sort of the women's health side, something that you've seen, I've seen, is that pregnenolone at these types of doses can reduce the dose of progesterone that a woman would use for things like hot flushes and things like that. I mean, that's plenty for sure. I'm just wondering if there's anything else at all that you've seen that is worth noteworthy, and if not, I'm sure that we'll both keep on working with it, and we'll find out new things.
I'm sure there's a lot more to this say. And one of the things, that little video I showed you, is that we haven't paid very much attention to pregnenolone. When you start looking for studies, it's minimal. And if you look for books written on pregnenolone, which I just did, there was an early one by Ray Sahelian, and he was talking about how it would improve your brain and your mood, which it does, but he only recommended 10 to 20 milligram doses.
Wow. That's a lot less.
And that's quite a lot less than we're talking about now. I really believe that this has to be specific to the patient. Like if I had a serum level.
I just want to share that. That's why I kind of learned and picked up by talking to different people, those types of doses, those low doses. But I also noticed that the response to those types of doses wasn't consistent and there were some reactions. And that's why I kind of backed away from it and haven't really touched pregnenolone for a long time until, we were talking about those very high doses. And I thought, oh, okay, well, maybe it's just like progesterone. Maybe it's worth being used and recommended at those higher levels. And so far, it seems the results seem quite positive, quite interesting. And this thing about arthritis, that's another area that, is worth really exploring. So, yeah.
There was a study done, and the idea was to show that pregnenolone causes convulsions.
Causes convulsions.
And guess how they did this study? They took rats and they injected 10 milligrams of pregnenolone into their hippocampus.
Well,
and if they injected more, the seizures got worse.
anything into the hippocampus, that itself is invasive and irritating.
I know, just the procedure, probably could do it with water or saline or anything. That's incredibly, it just sent me on a thought pattern, like, how dare we do such stupid studies? And
Dr. Repeat was
both on humans and animals.
Dr. Repeat wrote about the use of progesterone for convulsions, the successful use of progesterone for convulsion. I've used that before, and it would make total sense for me to try pregnenolone for that. It makes absolute
it
sense.
works, especially if they're catamenial monthly seizures. Katarina Dalton, I believe she had that herself, and getting progesterone injections just took care of that seizure picture.
But not directly to the hippocampus.
Theoretically, it should work. So most of the seizure medication, by the way, they're all directed at the GABA receptor.
Right.
And that's where and to my surprise, I learned this from a nurse practitioner, that the GABA receptor has all kinds of docking areas, like maybe 40. And I learned that benzos have a place they use, and the anti-convulsant drugs are benzos. Allopregnenolone, which comes from progesterone through 5-alpha reductase, sits there too, but in a different spot. So pregnenolone also has a pathway to create allopregnenolone too. The GABA receptor needs the allo.
And
GABA.
That's an approved drug for depression.
Yep. So GABA itself has another place, not the same as allo and not the same as the benzos. So so if you have a situation where you think you need GABA receptor support, you could use pregnenolone in GABA, even though they might be on a benzo and you're not ready to try to bring them off.
Makes a lot of sense. Yeah. Wow, such an important, useful piece of the puzzle.
Oh, I'm so glad you brought this up. I think it's evolving that we're now paying more attention.
Yeah. Hopefully this video will garner more comments and more inputs from other individuals who might have other experiences with pregnenolone. Wow, good stuff. Okay. Again, thank you so much for sharing your wealth of wisdom and experience. Very exciting. Yeah. Maybe we'll do something else a little different next time.
Okay, anytime.
This was fantastic. I really appreciate it.
I'm glad you brought up pregnenolone, the unappreciated hormone.
Yes. Yeah, for sure. Okay. All right. Thanks, Carol. Okay. Bye.
Bye.
Okay.